I'm Dr. Chase Hayden from the Hayden Institute, where we help our patients to be healthy and well without the use of drugs and surgery. If you've been following our gluten sensitivity series, you'll notice that gluten really messes us up if we're sensitive. So therefore, whether we have a neurologic condition, a digestive condition, a hormonal imbalance, whatever our symptom might be, it may be beneficial to be tested for gluten sensitivity in order to prevent the increase of symptoms and the reoccurrence of them in our own lives. In addition to many neurologic symptoms that gluten sensitivity can be associated with, like we've talked about in other videos, such as peripheral neuropathy, ataxias, headaches, dementias, etc., gluten also has a correlation between psychiatric disorders. So a great article recently came out in the Psychiatric Quarterly that talks about the association between gluten sensitivity and celiac disease with a variety of common psychiatric imbalances. Some of these include anxiety, depression and other mood disorders, autism spectrum disorders, schizophrenia, and attention deficit hyperactivity disorder. With these symptoms being present in so many Americans today, there's beginning to be more research that shows that gluten can affect these specific parts of the brain that lead to psychiatric imbalance. So when patients come into our office, even though we're chiropractors and nutritionists, our main goal is to identify the cause of what's going on. We treat the person for who they are, not the condition. So therefore, if someone comes in and tells us that their child has learning disabilities or ADHD, or if they're having anxiety imbalances, our first step is to look and see what might be causing that for them. And we recommend testing for gluten sensitivity many times so that we can identify if that's a cause or at least a contributing factor to why they're having the imbalance that they have. Gluten sensitivity testing and celiac testing isn't necessarily the same thing. So many of our patients that have come in with imbalances that are being treated by other doctors and we're just helping right along with them have already been tested for celiac disease. But as we go through and identify through specialized testing other portions of the gluten or the wheat molecule, we're able to identify if there are other sensitivities that are present, to whether it's to the gluteomorphin or the gliadins or the other portions of the wheat molecule itself. So therefore, if we have psychiatric disorders, whether they be anxiety, depression, mood swings, or other mood disorders, ADHD, schizophrenia, autism spectrum disorders, it could be beneficial to be tested for gluten sensitivity as well, in order to remove that food from your life that could be irritating or aggravating those symptoms that you experience. Once again, gluten is found in wheat, barley, and rye, and many times in cross-contaminated oats. But without the test, we don't truly know if that's causing the problem or not, or at least contributing to it. Once again, I'm Dr. Chase Hayden, and I'm at the Hayden Institute, where we help our patients to become healthy and well without the use of drugs and surgery.